A KXAN investigation airing tonight at 10 highlights a state office lawmakers shut down 3 years ago that some say could have been helping Texans like Eva.
Its sole purpose was to address health care issues like COVID affecting minorities in an unequal way. KXAN investigative reporter Erin Cargile joining us live to talk about it. Erin, what got you looking into this specific topic?
Yeah, good afternoon. So it was actually a tweet that we ran across from State Representative Donna Howard, a Democrat here in Austin, who said in this tweet just a few days ago, in 2017, Texas cut the only state office dedicated to investigating and solving racial inequities across the state's health agencies. And in that same tweet, she said she would be working to revive it. So we were very curious. And the more I started digging, the more information that popped up from some lawmakers, thinking this office would have been a vital tool right now during this pandemic. Now, the name of the office is long and it's changed over the years. It was called, in its last existence, it was called the Office of Minority Health Statistics and Engagement. And a former employee of the office who I interviewed for the story says, if it still existed today, it would have been collecting data very early on about which populations were most at risk of getting COVID based on existing health conditions, and then taking it a step further, going into those communities and doing what they could to educate and help prevent the spread. As it is now, data shows COVID is hitting Black and brown Texans harder than white people. That's nationally. They're not only getting sick more, but here in Austin, more Hispanics are being hospitalized than any other group. And some lawmakers have been very critical of the state, saying that if they started collecting this data that they started collecting it too late, and it's still incomplete, and they don't believe they've done enough to come up with solutions to address it.
So, Erin, this office sounds like it would have been helpful. What happened to it?
So in the 2017 legislative session, during the budget process, lawmakers defunded it. Democrats blame Republicans, saying they zeroed out the line item in the Appropriations Committee. Republicans tell me they were under the impression that this office, the work it was doing, was going to continue even without the funding. And the office, it had a budget of about $2 million a year, had about 24 employees. Lauren Laveris was one of them. She still lives here in Austin. I sat down with her, and here's what she had to say about not having this office during COVID.
It doesn't make sense for us to not have a program that's looking at this data and looking at what the chronic health conditions are and what the predictors are. And when people of color are vulnerable, the whole state is vulnerable. Like, it doesn't just impact us.
And a lot of our conversation also entailed, what work she was able to accomplish when this office existed. That's in the story tonight at 10. Also, you can read even more about it in the online story because, we wanted to know, was it effective when it existed back in the day?
Well, Erin, what's happening now? Will this office come back?
So, Robert, nothing can happen until the session kicks off, but bills can be filed now. There's a Houston lawmaker I spoke with for the story who plans on filing a bill to revive the office. And also, just last week, a senator from Houston filed a bill to bring it back in a smaller capacity. I talked to him about the details in that bill. That's in the story online now. And you can also learn a lot more if you watch tonight at 10.
All right, Erin Cargile, thanks so much for being with us here at 4:30.